just want to tell you how glad I am to be here and how lucky I feel to have my job. I love what I do for a living, and I wanted to thank Kim personally. Kim and Rob Gear were really instrumental in bringing me on board, and they were kind and very thoughtful about how they went through this process to find someone to fill huge shoes. I know how big my shoes are to fill, and I just want to assure you that I'm working hard at filling them and moving the organization on into the future. I wanted to take a second to thank my pit crew. I have an awesome pit crew in Columbus, Ohio, Reynoldsburg. I'll just name them off. Nancy Carney, I don't know whether she's in the room. Lance Johnston, who is now our Director of Family Services, doing what we all know he does beautifully. Lisa Weston. Another Lisa's here. There she is, beautiful. Lisa worked diligently on the beautiful programs that we have this year, donated by North Coast Litho in Cleveland. The owner of North Coast Litho has a nephew with Batten disease and wants to do everything he can to make us look fantastic. So we're very grateful for his gift. And Donna Gunn, as you know, is the heart and soul of our little organization, and she's out there registering people as we speak, I'm sure. So I hope you can say hello to all of them. I really want to rename my speech, my talk, my slideshow today to BDSRA Tomorrow, because I think that's really what we're all about. We're a room full of people who really have great hopes for tomorrow. Since I've started working at BDSRA, lots of people have said, "Where are you from? Where are you from?" And I always take that as a question of, are you like me? Do you think like I think? How do you think? Where are you from? So I put a few slides together about where I'm from, and I'm just going to speed right through them. So you can find out a little bit about how I think, where I've been, and where I want to go with you. I'm from there. That's Newark, Ohio. That's the county seat of Licking County, named after the salt licks that the deer used to find. It's an Indian, it was named by the Indians, the Adena Indians. There's a ton of this where I'm from, a ton. We're surrounded by it, and lots of these. These are my dad's. This is where I grew up. And this is where I learned my fashion sense. The brother on the right is an engineer. His name's Charlie. And the middle one is a journalist for USA Today, if you can believe it. The hat. And then, well, you know. These are my folks. My mom's gone now, but my dad's 90 and says hello to all of you. And they're funny. They're just funny, you know? And so, there you go. And I wanted to be her when I was 10. I did not want to live on a farm. I did not want to weed the garden. I did not want to feed the calves. I wanted to turn the world on with my smile and live in Minneapolis in an apartment and had a job in a high-rise. After college, OH, beautiful, thank you. In my master's program, I became a clinical social worker. But instead of working in a clinical setting, I chose to spend time as a legislative aide in the Ohio House. And that's where I really learned about how government processes can help people who are the most vulnerable. And I got calls every single day from people all over the state who needed lots of help putting their lives back together after a job loss, or they had a sick child, or they needed help managing their Medicaid account. They just didn't have a knowledge of how to access government to get what they needed. It's very, very important. Any of you who have children who need services that are related to government, you know how confusing it can be sometimes. And so I learned a lot there about how to work with families. After a time, I decided I really wanted to do some clinical work. So I started working in a psychiatric hospital. I'd been trained in my master's program by the National Institute of Mental Health, and I was interested especially in rural populations and depression, and I saw a lot of it. And that just was a great experience for me, to be able to combine the government experience with the real-life clinical experience. And of course, for me, as a curious person, I became more curious and started asking questions about how we could bring more of these ideas together to cure and to help people with real vulnerabilities. And so that's been my question throughout my career. How do we care for our most vulnerable? So I left for Chicago because I still had the Mary Richards in me. I still wanted to live downtown in a high-rise. So I went to the University of Chicago on an NIMH scholarship, and I started asking bigger questions and trying to find answers to those questions. With the biggest one being, how do we mobilize resources to change systems of care? And at that time, I was interested in how we serve the most vulnerable people with severe mental illness, those with very severe problems that make them vulnerable in the world, and sometimes make them homeless, and sometimes they die sooner than others because they don't have people looking after them. So I used all those skills when I left. I came back to Ohio. I met the love of my life, Dave Lippert, who's in the back of the room with the camera. Thanks, Dave, for all you're doing for us. And I applied those skills and began asking more questions in a variety of other fields that I've worked in. When I came back, it was the height of the AIDS crisis. There was no cure, and we were working in Ohio to develop systems of care to find physicians who would be even willing to have somebody with HIV walk in their door, because at the time there wasn't anybody who would do that, especially in rural Ohio. So I worked on that. And then I worked in the foster care area and asked the same questions about more vulnerable children and women's health. And NAMI with National Alliance for the Mentally Ill. And finally, in my latest position at the Attorney General's office in Ohio, I worked in the area of human trafficking, trying to figure out how we pull down money from the federal government, align with those law enforcement officials and private nonprofit organizations like the Salvation Army to help people who are really, truly vulnerable in very difficult situations. And all of these areas I've worked in have really helped me build a public policy, clinical, and scientific background in social sciences that I think we can apply to BDSRA. And that's what I want to do. How can BDSRA best support those who have that disease and find cures? So that's why I wanted to talk about tomorrow, because I wanted to talk a little bit about my next 6 months and what my vision is for my 6 months and my orientation, and how we can begin to build on a fantastic foundation that Lance and the rest of our pit crew have started. It's phenomenal. When Kim went over all that's happened in the last 25 years, I was just in awe. And also just a little, like, holy cow, I've got work to do to keep the momentum going. But we'll do it together. We're going to listen. We need to listen the first 6 months of any job, of any 10 months of any job. There's a Cuban proverb that says, listening looks easy, but it's not that simple. Every head is a world. Each head you have in this room is a world, and I've got a world after world after world after world to listen to. And we want to do that together, because that is the way we'll find services and programs that are meaningful to you in real time. They're important. In the next several months, I'm going to be holding a series of listening sessions, or focus groups, as they like to say in the marketing world. I want to find out in collective ways what you have to say about our services, about what's happening to you in your communities, what ways you have found around things. There's nothing more creative than a parent who has to do something for their child. And so I've got lots to learn from all of you, and we want to develop ways for us to collect that information in good ways that make it accessible to you. So that's one of our tasks. And so I hope you'll just pull me aside at the conference and say, I want to be part of that, because I want you to be part of it. I may just have to call you if you don't do that. We're going to use social media, as Kim said, to allow us to understand our families day to day. Every day I'm moved by all I read on our Facebook posts. Some of them are just incredible. The support you provide to each other is amazing. If you haven't asked to be in our closed Facebook group, I hope you will. It's a wonderful way to meet people and find out what others are thinking about a variety of topics. One of the things I do to listen and believe in very strongly is program evaluation. We need to take a much harder look at the programs we provide, whether they're doing what they should, and how we improve them. And it's a continuous quality improvement process that we'll be engaging in to look at each of the things we're doing. We're going to build, we have a great foundation. We have a wonderful array of programs and people and researchers and donors in place, and we just need to build on those. We're going to build meaningful, evidence-based support programs. And what I mean by that is we support lots of researchers as they try to find treatments and cures, and Danielle is going to do a great job in a minute of talking much more about that. But we can also learn in a scientific way about what works in terms of stress and coping for parents, how siblings are reacting, what kinds of services are most meaningful to them from a scientific perspective. And we can engage other researchers to look at that kind of thing. And there are donors that will pay for that. We're going to build alliances with other rare disease advocacy groups. We're going to build many more alliances with new donors. We have what it takes to capture their imagination. All they would have to do is talk to one of you and understand your world, your head. We're going to greatly expand our corporate foundation and individual donor bases. Harness. My husband makes fun of me all the time. Can I just say, he says, for such a smart person, you watch a lot of Access Hollywood. Well, you know, how does that compare to Shark Week, I ask you. So one night he talked me into watching PBS, which I adore, and it was on the Grand Coulee Dam. And it was right before I was starting to develop my ideas, and I really kind of see BDSRA, and a lot of what we're doing is the Grand Coulee Dam. You think about what's been harnessed and the power that a dam like that can put out. That's how I see us, is harnessing and aligning. We're going to align our members, our donors, our best hopes for research and treatment, and Danielle's going to talk about that in a little bit. New processes for research funding. We're going to invite Batten Family Foundations to join strategic partnerships in our funding efforts. Advocate. It's a constant thought process for us. It's how we advocate best for our families. Those in government can help us, and we're going to do much more in the way of government relations. I don't think we've even tapped that as much as we really could, and it's part of my past world, and I want to bring that forward. In schools, we'll continue to advocate. We have a great, as you know, a great team out there all over the country who will help you with IEPs and making sure that your children get what they need from their school systems and their medical systems. We want to advocate in your communities. We are there to help you to write letters, to talk to your reporters, to talk to your Congress people. to talk to those who matter in your communities. We're there to help you do that. That's our job. This is our vision. We're a movement. Everyone matters every day. That's it. That's what we'll do. And with your help, I'm thrilled to be here. Best job I've ever had. Thank you.